Guys, welcome to another video by That Dentist Guy. Thank you for the 200 subscribers. So today we'll be talking about lymph nodes, in particular the cervical lymph nodes. Okay, so we'll be considering the Memorial Sloan Kettering Cancer Center classification of cervical lymph nodes. So basically the lymph nodes are named according to the location of the vital structures that are close to it, right? So the first group of lymph nodes are present right here in this area. So they are divided into 1A and 1B. 1A is the submental triangle region. Okay, 1A is the submental triangle region. Sub as in below, the mental region. So the submental triangle. This triangle is bound by the anterior bellies of the digastric and the omohyoid muscle. So coming to the submandibular region, that is the 1B. This is right below the submandibular salivary glands. So this triangle is bounded by the anterior and the posterior bellies of the digastric and the body of the mandible. The body of the mandible I have not shown it, but you should just imagine this is the anterior border of the digastric and this is the posterior border of the digastric. It is bound between these two spaces, 1B, which is the submandibular triangle. Coming to the second group. This group is the jugular group. So this can be divided into 2A and 2B. So 2A is anterior to the spinal axillary nerve and 2B is posterior to the spinal axillary nerve. So the spinal axillary nerve here, it cannot be seen because it's covered by a layer of muscles, but you should just imagine it. Okay, so the 2A is anterior to the spinal axillary nerve. The digastric muscle is, as you see, it is present superior to it, and the hyoid bone or the carotid bifurcation is present inferiorly, somewhat here. The extension of the hyoid bone will continue to the back here, and obviously there will be the carotid bifurcation inferiorly. Obviously, even though it's kind of stupid to call it obvious, it's obviously there. You should just imagine it. Okay, so the next group is the 2B group of lymph nodes, which is posterior to the spinal axillary nerve. Now we can see that again the digastric muscle is still there. Even though I've made it excessively thin, you should just imagine a really thick digastric muscle which is present superior, and of course the hyoid bone, and then since inferiorly to the 2A group, which was anterior to the spinal axillary nerve, was the carotid bifurcation. So for this also the carotid bifurcation will be present inferiorly. So now we have completed the jugular part. Now coming to the third group, which is the middle jugular nodes or the jugulo-omohyoid group. The carotid bifurcation is present superiorly, since this was present inferiorly for the second group, and then superior to the cricothyroid inferiorly. So this is the cricothyroid. So this will extend up to the inferior part of the third division. Coming to the fourth division, which is the lower jugular. Coming to the lower jugular nodes, again the omohyoid muscle is present superior to it, as you can see, and then you are coming very close to the clavicle. So the clavicle will be present inferiorly. Okay, so this is the clavicle and this is the omohyoid muscle. So the lymph nodes you have to imagine in close approximation to these structures. Now coming to the fifth group of lymph nodes, which will be present here. So the fifth group is divided into 5A and 5B. Both form the posterior triangle. Okay, posterior triangle of lymph nodes. So along with the lower half of the spinal axillary nerve, remember the spinal axillary nerve, which was the cause for differentiation into 2A and 2B, the same spinal axillary nerve, and the transverse cervical artery is also present. Again, you have to imagine all of these landmarks, and also includes the supraclavicular nodes. So this is the clavicle and the supraclavicular nodes. So these are all hidden within this space, which is the posterior triangle. Now coming to the last group, which is the sixth group, which is the anterior triangle, right here. So the anterior triangle, the most important thing that is in close approximation is the hyoid bone, which I have marked here in blue. So this will form the superior part of it, and the suprasternal notch, which is present somewhat here, will form the inferior border of it. Guys, I hope you understood lymph nodes. It's an important 5-mark questions for us, and Just by making this diagram, of course you can't make it colorful like this in the university exam, I just made it for your reference. But if you make a part of the, say, the cricothyroid, you make the hyoid bone, you make the digastric muscles, and you make the other muscles which make up the neck, like the trapezius and all, and the omohyoid. If you are capable of doing it, go ahead, do as many other landmarks as you can, but minimum there should be these, because these are what is used for identifying which lymph nodes they are. All the best for your exams. Do well. I hope I do well too. All the best. Bye.